Hello, and welcome to this lecture about the conditions which involve the hormone ADH. In this lecture, I will be looking at the causes, features, and treatment of SIADH and diabetes insipidus. Diabetes insipidus. This is a condition where there is a deficiency in ADH. ADH is a hormone produced by the posterior pituitary gland, and its action is to stop you from peeing. It's an anti-pee hormone, so it stops you from urinating. Its causes can be divided into cranial or renal, nephrogenic. In cranial diabetes insipidus, there's a deficiency in the production of ADH, and its causes include CNS tumours, head trauma, and infection. In nephrogenic diabetes insipidus, there's a lack of response to the ADH hormone by the kidney, and causes include lithium and chronic renal disease. Because you're not able to produce this hormone or act upon this hormone, you can't therefore stop yourself from urinating, so the features include polyuria, noxuria, weight loss, and dehydration. So it's no surprise then when you measure the plasma and urine osmolality, what you find is a high plasma osmolality and a high plasma sodium, and a low urine osmolality because you can't concentrate the urine. The water deprivation test is used to find out whether someone has diabetes insipidus. This test is conducted over 8 hours, in which fluid restrictions also occur. The patient's weight will be measured at the start and at every 2 hours. The urine and plasma osmolality is also measured every 2 hours. And if you have a positive test, you find that the serum osmolality will rise above normal, and you also find that the weight will drop greater than 5%. So there's a greater than 5% drop in body weight. So both of these will indicate a positive test. Once you know somebody's got water deprivation test, the next thing to do is to find out where it is. You do this by giving desmopressin. If the urine now concentrates after giving desmopressin, then you have a cranial cause. If the urine fails to concentrate, then you have a nephrogenic cause. You can also do an MRI to look for any possible tumours. Treatment includes drsmedicine if it's a cranial cause, or you can give thiazides and NSAIDs, and what they do is sensitize the renal tubules. SIADH. This stands for Syndrome of Inappropriate ADH Secretion, and as the name suggests, you have an excess of ADH. Causes include pneumonia, TB, cystic fibrosis, lymphoma, and brain disorders. Such brain disorders include meningitis, encephalitis, brain tumours, and brain abscesses. Features include confusion, appetite loss, fits, and nausea. When investigating this individual, you'll find that the individual will have a low sodium level, a low plasma osmolality, and a high urine osmolality, because they would be producing a very concentrated urine sample. Treatment includes treating the cause, restricting fluid intake and replacing the sodium, and in some cases you may give demiclocycline, and this inhibits ADH. Thank you for listening, and I hope this lecture has helped you in your revision.